Today, my guest is Sumbal Shahbaz. She's from Pakistan. She is assistant professor on public health at Superior University in Lahore in Pakistan. She has bachelor's on anesthesiology. She worked at the hospital for 8 years. Then she did her scientific research while doing master's and PhD on public health. Today we will touch the questions of waste in medicine, try to reflect on the possibilities of reusing and recycling in medicine, and also we will use our chance to talk a little bit on the gender questions in science and in medicine. As you know, I'm doing a professional fellowship in Germany currently, and within this program we have other fellows from different backgrounds doing also professional fellowships in their segment in different organizations here, and with Sumbal we are in one working group on sustainable development. I'm very happy to have you today. Sumbal, how are you feeling today for recording this podcast?
Feeling good. It's a new thing for me because I have never been interviewed before for a podcast. Yes, it's feeling. I'm really feeling good.
Sumbal, can you explain what kind of fellowship and activities you're doing in Germany?
Well, I'm right now associated with Econ University of Human Sciences, and they work on global health. And the concept they are working is on planetary health, which means one health for all. I mean, everything that is our planet is affecting our health, be it the environment, be it the plants or animals or even insects here. So we are working on combined health and the sustainable development of our planet, our people, our health together. In my home organization, it's basically Superior University, and it works in multiple fields like engineering, technology, and also they have medical and allied school. So I am part of their medical and allied health sciences school, and I'm working in the Department of Public Health here, and we basically teach public health and bachelor's master's program, also anesthesia, radiology, nutrition, and a number of programs in our medical school. So it's a good school, so we should visit it.
So you are assistant professor, but your background is medicine. You have studied your bachelor's in anesthesiology, as I understand, right? And you did your master's. You worked at the hospital. What was the reason you moved to do science?
Well, actually, I started as a clinician. It's a very new thing in Pakistan, and we don't focus on the public and global health aspects. Especially, you see, in 2011 in Pakistan, the dengue virus that came and like killed hundreds of people, and in that time we had to ask other countries to send in the specialist who could teach us how to manage this all. So it was time then I decided that instead of working as a clinician in hospital, I should be working in research and planning and to improve our health system altogether and make health improve and inclusive for everyone in Pakistan.
You are teaching future medical students. Can you tell the ratio of female and male in your courses?
To be very honest, in Pakistan, in all the leading medical universities, girls are in 80% of the out of 100%.
Oh, that's so nice ratio. Yeah.
That's perfect because it depends on your marks and to get admission there, and girls are usually getting more marks than boys, and all the medical colleges are full of female students, and which is not a good thing, I would say, because once they get their degree, most of them, like out of those 80%, 50%, more than 50% would go and stay at home and become stay at home mom and anything. And due to that issue, we are facing shortage of many doctors in Pakistan. We are left with a lot of females in hospitals, and then we face issues for their evening night duties. And yes, I think a lot of medical students don't go to practically performing their duties. Yeah.
Maybe there is also, indirect effect of making women educated in medicine because then their families will have less illnesses, no?
Not exactly. Maybe people want to have a free doctor at home. Yeah. So usually you see moms or guys finding female doctor for their sons, and then the girls they just stay at home. I mean, it's good. An educated mom raise good kids, but what about all the state that invests so much in making you a doctor, and then you don't practice at all? So I believe that's a loss as well.
Yeah, agree. That was a quite nice joke, just making a positive thing on making the women to study. As I am not in a medicine, but it seems to me there are also masculine and feminine parts of medicine. Like surgeons are usually a man, and gynecologists are usually a women. But anesthesia, this is a female job or masculine job? What is the direction in your country?
Well, it's not definitely unidirectional, because I've seen males and females, all of them in this field. Yes, for gynecology, we have only females because it's a bit of a religious issue in Pakistan. People don't opt for like male gynecologists, and for surgery, somehow we have a lot of female surgeons, but their practice is not going very well because people generally consider that surgery has to be done by a male surgeon and he would be more responsible. Like, I don't know why, when they can perform gynecological procedures, why they can't perform general surgery as well. So somehow it's biased, but in anesthesia we don't see that. We have equal number of male and female.
Now I want to move to another part of our podcast related to the waste management circularity, because our podcast is calling say something circular. So let's move to the waste related questions in medicine. In terms of waste management, we have a solid waste, hazardous waste, and a wastewater inside the medicinal entities. And as a person from inside of these practices, maybe you give your general understanding and general practices what you follow in your hospital.
Well, actually, in our hospitals, there is a separate person who deals with all this. I mean, in theaters, all the protocol that we follow is to keep specific patients like Hep C patients or AIDS patient at the end of list. I mean, they must be the last person to be operated, so that we have like guidelines that we have to remove certain parts, certain things permanently from the operating tables, or the gloves, the mask that is used with them. We have to discard them after cutting, so they cannot be used or reused, and because it can transfer disease to other person. Related the other waste, we have specific people who take care of them, but these diseases like AIDS and Hep C have the waste is totally packed in separate bags, and they are disposed of in a separate way. It's like yes, we have separate bins for sharp objects, for like pathological waste in general, but for the patients of AIDS and like HIV and hepatitis B and C, we don't use the regular ones. They're all the waste material is disposed of specifically, totally separately.
So you have a responsible person who takes care of this waste and sorting them, and also you have a separate allocated area, a closed area for keeping any medicinal waste out of household waste. That's what I understood.
Yeah, definitely. There is a separate room, and even in that separate room, we have separate area for like the diseases I'm talking about for their waste, and the waste has to be removed after every shift. Like we have 3 shifts: morning, evening, and night shift. The waste has to be removed after every shift, and the responsible person make it sure that it is disposed of properly.
Then another very interesting question. I think this is also must be asked from professionals inside the medicine. There are several understandings like reusing, recycling, reducing. I want to ask whether there is any place or room for reusing and recycling inside the medicinal waste. What do you think?
Well, actually, yes. Initially, there were a number of things that we used to reuse after. Like we can reuse for several surgeries, but with time the disposable things has taken over. Why? Because I think they can contaminate patients more if we don't disinfect them properly, because you cannot recognize actually that this has been disinfected and this not. And the initial reusable items used to increase the contamination, so the most of things are now replaced by disposable things. Like in anesthesia we used endotracheal tubes and mask, and all those things are, and gloves, all those things are disposable. But it's also important that the disposable stuff is discarded and they are not again reused. About the syringes, we have to discard the syringe after using. If not, the drug addicts or any people, even people in small clinics, they make reuse of these things. So I think it's responsibility of everyone to take care of this thing, that their syringes that are used on them should be discarded right in front of them.
Actually, this is a very interesting question. I sometimes I come across with the artistic exhibitions when they try to reuse some medicinal waste, like one time gloves or one time shoe covers, which I think is not that safe to reuse anyway. So I just I just want to say that there are plenty of household waste that you can reuse, but medicinal waste is not that big place allowing to reusing recycling. In most cases it must be incinerated, and incinerated in a specialized technology machineries that makes even harmful gases to keep inside. As being a woman in science and technology and medicine, it is much challenging for an Asian woman to be a professional, to be successful in career, to be successful at family. And I should ask this question: how you are making this happen, and how it's possible? What kind of practices you can advise you do yourself, and what's important here?
Well, I believe the main issue with our Asian families is that we are now raising our girls in a better way than before. We focus on their education, but what we don't used to practice is that we make our son enough open-minded that they can let their women work in practically in life. So I think family has a big role in making a woman, for a woman in a woman career. Like my parents always focused on my career, and they are still doing it. Like I'm here and my kids are with my parents and my husband, and I'm very happy that I have a supporting family and husband as well, because without this it was never possible to work and balance a family life along with that. And I always say people that what we Asians need to do is focus on our sons to make the life easier for their women, because I believe that women are excelling a lot in Asian countries, but what's keeping them away in their practical life is their supportive family. So if we make boys learn that they have to support their girls or their wives or their sisters, everyone, so we can excel, our females can excel in every field.
Yeah, very, very applaudable statements, because being as an Asian woman, the family support is everything. If you will have this support, you reach your goals, you do your career, you study, you work, you have your family and children happy and healthy. But this is very important to have a family support. You said that your children are with your husband while you are doing a professional fellowship in Germany. Maybe you give us how to keep this balanced relationship with your family and husband.
I believe a good understanding is the base of every relationship, and I always wanted to make a career. So I always went with the norms that our society had, like get married and have children. But by side, I focused on my career, never stopped learning, never stopped working. And of course, like, male partner has to put an effort as well to make compromise and make his part. So I believe my spouse made his part as well, and he supported me in every way, because it's not just about family. You get a lot of backlash sometimes from society as well, because they consider you are self-centered because you are not focusing on your kids and family alone. So it was not me, just my spouse as well, who always made sure that I'm doing the right thing, that I'm focusing on my career as well.
Yeah, probably there were a lot of people who were judging, also giving own statements on what you're doing. It's always part of being evaluated by others, social norms. What do you do at this time? How do you lift your motivation? How do you empower yourself?
Well, I always had trust in Almighty, way that I believe what I wanted to do, I'm always doing that. So I stayed focused. I never listened or cared about what people think about it, but except the near ones who really mattered in my life, and those who really mattered, they focused on what I want. So I think this is a win-win situation, that they cared for me and I did for them. But related, I would say every woman who wants to make a career, never focus on people who don't matter in your life, because they are just to let you down. And if you will think about them, you will definitely get down. So you have to focus on your goals and people near you.
True, true. Focus on only people who have positive impact on you.
Yeah.
You know, with Sumbal, we are in one working group within the cross-cultural fellowship here. We are both in a sustainable development group, and we are working also in a separate groups together. And I want to say a compliment to Sumbal, that she is very perceiving girl. She is very energetic, and she is very result oriented. And I want to tell that this is one of the traits that a woman with a lot of requirements, a lot of work to do, socially, family oriented, and a job. This kind of energetic and perceiving approach is very helpful. From this episode, I'm adding to the podcast one more part related to the discussion of a technology. I want to ask about one technology that we very much obtained during the COVID. This technology is pulse oximeter. Before COVID, it was something related only to the emergency rooms. And only to the operation rooms. Now almost every household have it, while they were ill with the COVID, or just to keep themselves safe in monitoring. Now COVID is gone, hopefully. Then we have this pulse oximeter still in our houses, and this is part of being a circular and repurposing the electronic devices what we have. What we can do with the pulse oximeter, how we can reuse it or to use it more frequently than just putting it to the box and it's just under the dust, or we throw away because we don't use it anymore.
Okay, so first of all, I would say COVID is not gone. Like before, like in 19th century, influenza, it is still H1N1. It is still here, but because we all have it once, so we are somehow immune to it. But it's not gone. So we cannot say that we would put it in box and place in a cupboard. We can use it whenever you face something extreme cough and symptoms like that. You can use it. Also, the patients at home, the asthmatic patients, the COPD patients. For COPD, I mean chronic obstructive disease. So with that, the patients with COPD, we can use them. We can understand their health condition before even going to a physician at home. So I think it's really very useful, because this pulse oximeter tell you immediately your oxygenation levels, and somehow when they are getting down, you know when to put in when you have to go to the physician immediately. So it's very important, like you have a BP apparatus at home and you can use it whenever you feel that your BP is shooting. So same way, when you feel shortness of breath or any symptoms like that, you can use it for sure.
Yeah. There is also showing the heartbeats or heart rate or something. I know that something to the heart is also there.
Yes, a few pulse oximeter also show heart rate, but we don't use heart rate probably as a measure of health, because it can go up after a walk, after a run, or maybe if you went to some athletic contest or any gym, maybe. So it can go up and down. But yes, pulse oximeter is a very useful thing, and it could be used as a health measure regularly.
Okay, nice, nice. Now we please don't throw away your pulse oximeters. Second episode of podcast has ended, and I want to thank Sumbal for this conversation, and I want to also thank her for being intelligent and so knowledgeable. I appreciate very much your interest in the questions of waste management and circular economy. I do my best to bring your attention that all domains of life sciences are cross-cutting with the questions of waste management. And it motivates me very much when I see people interested in. For example, while we were recording this podcast, there was a lady in front of us listening and very much interested in. She works on the strategic development of NGOs, but she was very much into it. Therefore, I appreciate when you share this podcast and YouTube channel with your colleagues and friends. Those must not be necessarily from waste management. They can work on a life sciences. They can work on any domain that creates our system. So I wish you a good leisure time and see you soon.